Welcome to my speech on call to action speech, and my topic is errors to human in healthcare. Did you know that the daily medical errors related to the deaths in the USA is equivalent to losing a jumbo jet full of travelers every day? The concept of errors to human was introduced in 29 November 1999 by the Institute of Medicine to stand in for the deaths that occurred in the American healthcare setting due to systemic failures and issues they accounted medical negligence. The report observed that nearly 98,000 Americans died each year from medical errors. Since in the 1990s, there has been a significant improvement towards equality of the healthcare system in the United States. However, national level mistakes are still happening, and there is an acknowledgement that patient safety improvement is ongoing. For instance, reports adverse events and launching safety strategies, including checklists for surgical procedures with more attention to physicians' diagnostic errors. Therefore, my speech will outline healthcare system's current situation and highlight the significant improvement that have occurred to prevent the deaths that could have otherwise been avoided. If nothing done about the patients in the modern U.S. society, the country and indeed the world will continue losing 98,000 and more each year for preventable reasons. That's the real tragedy. Having said that, I will now highlight the significant proof that medical errors still exist within USA patient care system. According to the studies which was carried out by Marker and Daniel 2016, it highlights that the healthcare system still experiences death from preventable medical errors. For instance, the same study claims that over 250 patients still die from medical errors. On a different study which was carried out by Ortega, it indicates that medical errors are still the third killer after the cancer and heart disease. The same study which was carried out by Marker and Daniel even found much higher figures, and they claimed that the death toll to be about 440 people annually. I will now discuss the possibility that exists to prevent the medical errors that threaten the USA patient care system. It is possible to reduce human error in healthcare. However, this will not be done by bringing everyone on board, including frontlines of patient care, clinical administration, accrediting, regulating, and licensing groups, industry, boards of directors, patients, and their families, and government agencies. First step is creation of user-centered design that enhances human strengths by avoiding human weaknesses in processes. Avoid reliance of memory and vigilance. Attend to work safety, design for recovery, and anticipate unexpected. Train concepts for teams, involve patients in the care, and most importantly, improve the access to timely and accurate information. Medical mistakes can be reduced by minimizing clinical errors, improve the clinical performance, increase the application and evidence-based care, and enhance family-centered care. Another crucial step is reduction of complexity of the system through a number of ways, including reducing inefficiencies and non-value-adding tasks, improving patient-provider communication, and reducing burnout, and improving job clinicians. Certification is also essential to minimize healthcare errors. Further, suggests that the use of technology in healthcare as a vital reducing human error in medical care. I will now discuss the steps that stakeholders in the U.S. care systems have taken to improve care and prevent medical errors that threaten USA patient care systems. Several steps have been taken to improve the USA healthcare systems in order to reduce medical errors related to deaths. First, According to the study which was carried out by Schoenfeld, medical errors have been minimized through continued research to improve patient safety and patient involved in the care process. Errors have also been minimized by minimizing clinical errors, improving clinical performance, increasing application evidence-based care, and enhancing family-centered care. Safe storage of medication is being practiced. Second, multi-method approach is used to improve safety during cardiac surgeries. Infusion pump errors also prevented. These strategies will limit human factor errors. Errors can be also reduced by minimizing clinical errors, improving clinical performance, and increasing evidence-based care, and increasing family-centered care. In my conclusion, my speech will outline several proofs of medical error existence in the American care system and the associated statistical deaths. My speech has also provided evidence to demonstrate the possibility of reducing care through multi-sectoral and evidence-based approach. The proof that medical errors exist and the possibility of reducing such errors provide the ground for continued stakeholder involvement, including patients, healthcare systems, government agencies, and researchers in identifying the systemic errors, and always working towards an evidence-based approach in solving errors. Only such actions will usually prevent unnecessary deaths in our care systems. Thank you, and that's my speech.